We're listening across to that is Claudia Sorin. Claudia has campaigned against some of the proposed changes. And is it fair to say, Claudia, that one of your main campaigns is the changes to children's services at Dorset County Hospital?
Well, that's been the main focus for us in Dorchester. The Save SCBU, Kingfisher and Maternity at Dorchester, and as you said earlier, there appears to be a preference for option A on maternity and paediatrics, which is the shared Yeovil Dorchester model, as opposed to those services going over to the east of the county. So they've added overnight paediatrics and to keep the overnight paediatrics in Dorchester instead of it just being maternity.
Yeah, and your response to that, is that good news?
Well, we still don't know. We still don't know whether that means we'll keep. What it appears to mean is that they're suggesting they keep the overnight consultant-led paediatric services in Dorchester, but Yeovil will get the consultant-led maternity, which isn't a good solution for us. Obviously, it's good for the children's ward if that stays. That we're very pleased about that. But if we lose maternity to Yeovil, then that's not good for us at all.
It's interesting with these kind of things, isn't it? Because it almost feels like they happen very slowly and you kind of get used to the ideas as they go along. So there are proposals, then there's a consultation, there's a report back on the consultation, there's a reaction to the consultation. And I guess as a campaigner against these changes, trying to keep as much focus as possible within DCH, you have to fight this every single step of the way. Even these aren't kind of this response today. This is not the finished product. You now have to make clear your views on it so that the CCG know what you're thinking.
Well, exactly. I mean, our views remain the same. You know, as throughout the campaign, there was support for a huge amount of support. Like I say, not just our campaign, the Kingfisher, but of all the petitions all across Dorset opposing ward closures was getting on for 70,000 signatures, I believe, and these are only given a very, a small mention in this report.
Yeah.
They're only mentioned in passing.
I was surprised by that, actually. Even talking about some of the community hubs in East Dorset, say they'll just passingly mention the fact that there's a 6,500 signature petition against the changes. That's
right. And these numbers, thousands of people, tens of thousands who signed petitions, are much greater than those who took part in the questionnaire, which was, as we know, it was criticised by Dorset Health Watch for the way the questionnaire was designed in order to give a response that the CCG wanted to have, which was basically support for all their proposals.
Yeah.
But we're worried also. We're concerned about this telephone survey because we have a member of our health campaign who was contacted to do the telephone survey, and he believes that the type of questions that were being asked were possibly leading questions, and they weren't giving as much information to people as you would have had with the document, the consultation document and the questionnaire.
Okay.
So these questions on the telephone survey seem to be rather leading, and it was only about 1,000 people who took part in that. So and yet what concerns me is that it's been given as much importance in the report and in the data that's given on the responses. This telephone survey is given as much significance as the other types of as the other questionnaire.
Okay. Other responses.
And so that gives a skewed impression of the support, that there is much more support for the proposals than we believe there really is.
All right. Well, look, Claudia, we'll talk more about this after 8 o'clock this morning. For now, thank you, Claudia Sorin there, who is one of the campaigners against changes to children's services at Dorset County Hospital. Tristan mentioned that a final decision on these proposed changes will be announced later this year. It's 16 minutes past 7.